Thank you for being here with us at Direction Home. This is our brand new office space and conference space. So thank you for coming in and joining us. We wanted to show it off to you. So I think many of you are familiar with our Medicare seminars that we do, but we also wanted you to know who we are, right? My name is Lori Smith. I am the training coordinator here with Direction Home, Akron Canton Area Agency on Aging and Disabilities, the longest name for a company ever in the books. I have been here for, it'll be 10 years this December, in my current role for 8. But I wanted to quickly first go over some housekeeping things before we get started, and then share with you a little bit about who Direction Home is and what we do aside from these fabulous seminars, right? So housekeeping, I hope everybody had a moment to get coffee is on these 2 counters behind you, and then we have water and pop in the center. We will be doing our presentations today, and then lunch will be delivered. So you can choose to pick up your lunch, bring it back in here. We do have a lunchroom available straight across from the doors that you came in. You can choose to take it there, or you can take it with you. Dealer's choice. Oh, questions already? Yes, sir. I just didn't get any. That's my fault. So, okay. You look very svelte, though. Very svelte. Shh, you aren't kidding there. You are not kidding. If you do need to use the restrooms, please feel free to step out anytime that you need to. The restrooms are just across the hall from where you checked in. And again, feel free to stop in anytime you need to. In your packets, you should have Advantage Plan information and comparison charts for Stark and Summit counties. We also provide that information for Wayne and Portage counties. So if you need that as well, please let me know and we can get that for you at our check-in table. So we can do that for you either now or when we are finished up for the day. We are also streaming this live on Facebook. So when we do get to our Q&A portion of today, I will ask that you wait so we can bring the microphone to you so our fine folks on Facebook can also hear the questions. Okay, so any questions so far? No, awesome. All right, I'm going to go ahead and get started with, again, who we are as an agency aside from these lovely Medicare seminars. So up here on the screen, you can see our mission and vision. I'll let you read that on your own. But basically, what both of those statements together ultimately mean is we provide choices for people to live independently in the place that they want to call home, right? That sounds nice. In the place that you want to call home is what we do. Provide services to help do that and not just live in the home of your choosing, but thrive there, right? We want to be energetic, active, engaged people. So that is what we do. Who are we? This is a makeup of our staff. We are a privately held nonprofit entity. We are a part of a nationwide network across the US. There are 655 area agencies on aging. In the state of Ohio, we are one of 12, okay? Our area agency provides services to Stark, Summit, Portage, and Wayne. But as you can see up here, if you or a loved one is not within that 4-county region, let us know. We can connect you with an area agency on aging across the nation that can provide services and supports to help support that person, right? We might not have the same programs as another area agency on aging, but we all have that same mission and vision of allowing people to age in their homes, right? So we have a board of 28 members. Of course, our executive team that fearlessly herds us cats and leads us. And then our staff, I do have to update that number. We're about 260 strong now, mostly registered nurses and social workers. We also work with a lot of interns and volunteers, and these are some of the places that those people do engage with us on a volunteer basis. We have an advocacy council made up of partner companies and local community members that help guide our programs and see the needs in our 4-county service region and help us plan how we can best serve our people, right? Communications and outreach. So I am on that team, and we utilize interns and volunteers to help us go out into the world and let people know what Direction Home does. We do speaking events, we set up resource tables, and we have a lot of volunteers that help us do that. Our long-term care ombudsman department has volunteer ombudsmen that help our licensed ombudsman go out and make visits into long-term care facilities and make sure residents' rights are being upheld. Nursing students are some of our biggest interns, and they help our care management team. And then, of course, professional support and social work students as well help our care management team. These are just some of our most requested services that we get here at the agency, transportation being the top. I need help getting to and from doctor's appointments, to the grocery store, just to visit family. So we get a lot of calls on how can I get to and from. Nutrition services, things like home delivered meals, mom's meals, things like that. Yeah. Good. How do you support Meals on Wheels? You can call them directly and see how you can advocate for Meals on Wheels. I'm sure they have volunteer services. I'm sure you can make donations to them. They're always looking for drivers. Always, always, always looking for people to help drive for sure. But yeah, thank you. Meals on Wheels is a fantastic supportive service. Thank you. Yeah, absolutely. People also call us for utility service. So I'm having a little struggle paying my heating or cooling bill. We can help with that. Chore or homemaker service, need a little help around the house, raking the leaves, cooking meals, something like that. Emergency response systems. Y'all remember that old commercial, "I've fallen and I can't get up"? That's your thing. So we can connect people and get people those emergency response systems. And supportive housing. And what that is, the supportive housing program aims to provide opportunities for stable long-term housing for people who are homeless through supportive housing operations. And that program provides funding for operations and limited funding for services in permanent supportive housing and facility-based transitional housing programs. Who we help annually, aside from the people asking for assistance for those things on the previous slide, this is a snapshot on who we help annually. And you can see it's quite a few people. We've had more than 12,000 callers just calling in for information and assistance, more than 11,000 with Medicare and Advantage patients to avoid those hospital readmissions. So they've been in the hospital, they've gotten treatment, they've now gone home, and they want to know how to best care for themselves and follow that healthcare team's orders so they don't go back into the hospital. People assessed in the community, members who are care managed through our home and community-based services, our care management team, and then people who come to our continuing education classes. We do offer professional education to help keep our licensed individuals' certificates up to date so they can continue to work with us, social workers, nurses, nursing home administrators. So when you think of an area agency on aging, you can think of us as your front door to what community and government programs might be available to help us, right? How to get help so me or my loved one can continue living in the community, and where to get home delivered meals, senior housing, transportation, caregiving support, education, and so much more. And speaking of front door, this is ours, our Aging and Disability Resource Center. Every single area agency on aging in the nation has an Aging and Disability Resource Center. And we have trained representatives that when you call them, I am in awe of their knowledge. They have all the information on our programs and other community resources out there. They do program screening and eligibility for our programs. They can also help with Alzheimer's and dementia information, education and support, family caregiver support if that's something you're interested in, home and community resources aside from the programs that we offer, housing options available in our 4-county service area, and then we can also do in-home consultations and assessments. If you choose to do that, if you would like somebody to come into your home after talking with that Aging and Disability or ADRC representative, and you're like, yeah, I'm interested in one of your programs, I would love to hear more, see if I'm eligible. That ADRC rep can schedule an in-home assessment with you. First and foremost, they are free and open to everyone, as is calling our ADRC. They are a home-based assessment to discuss your long-term care options and assist with future planning. And it will be a registered nurse or a licensed social worker to come in and determine eligibility for our programs. And if they find that you are not eligible for one of our programs, they don't just dust their hands off and be like, well, it's been a lovely conversation. Thanks for the coffee. I got to go. They do connect you with other community resources that can help you get to your goals. Okay. So we can absolutely set that up with you. Yes. Oh, we're going to get to that. Yeah, we're going to get to that. So you've called the ADRC with questions. They've done that initial screening, connected you with that in-home assessment with our nurses or social workers. We've decided that, yep, you are a great fit for one of our programs. You are enrolled on that program, and now you are in touch with our home and community-based service department. That is our care management department, and by far our largest department in Direction Home. Our home and community-based services folks help older adults and people with disabilities accomplish their everyday tasks like bathing, dressing, getting meals ready, managing their money. And down below, you can see some of the programs that we offer here at Direction Home. Here's a slide of some of the programs we offer at Direction Home. And also in your packet, you have our brochure. And if you open that to the first couple of pages, you will see these charts that very quickly outline programs that we offer, who and how to qualify. But understand we had limited room to print, right? So if you see something that you're like, yeah, I might like that service, but just looking at this little chart doesn't feel like I would qualify. I'm just gonna close the book, tuck it away, maybe put it on the fridge. Please continue to call our Aging and Disability Resource Center and have them do that initial assessment and screening. They may see something that will allow you to qualify for one of our programs, and at least ask. And even if you don't, like I said, we've got other community resources available. So please, we encourage you to always, always call. So who is it? You're on one of our programs. We've got the care manager that is making sure you're getting the services that you want. So who is it that actually provides these services? We work with a large provider network, more than 250 contracted providers, including people who can do home health agencies send out a home health aid to you, including proprietary and nonprofit. Home medical equipment providers, if you need a piece of equipment in your home, adult daycare providers, home delivered meal providers, assisted living facilities, and more. We have a very expansive provider network. So we've got that provider network. We also make sure they are protected. This isn't the slide for it, but we have a planning and quality improvement department that oversees all of our providers, makes sure that they are doing what they are doing. They've contracted with us, which allows us to say, hey, we understand that you are going to give the best care possible, but then we're going to go ahead and make sure that they continue to do that, right? So that is our provider relations department. We also have consumer protections, and that's our elder rights department. Those are the folks that if someone is in a long-term care facility and they have any concerns at all, they will go visit that person, talk with them about their concern, and see if they can open a case to help get that resolved. And they will work with that person to resolve the concern that they have. They do complaint investigations and resolutions. They also offer information on Medicare benefits, rules, and options, something we're doing today. And they also offer long-term care provider selection assistance. So if you're considering moving into a long-term care facility, you can give them a call and they can walk through the different facilities in our area, what they offer, if it's a good fit for you. So that's our elder rights department there. We also have health and wellness programming. This is our preventative side of things. These evidence based classes are free to attend, and we can bring them to any facility that is welcome to host us. So we've got two that are based on falls prevention, and you can see me up there doing my work right now, which reminds me this slide has got to come down. Nobody needs to see that nonsense. But the first one is Tai Chi for arthritis and fall prevention, which is what I'm doing up there on that slide. It is solely movement based. We learn 8 forms of modified Tai Chi, and it helps to increase balance, strength, and flexibility. And then we also have something called bingo size, which is exactly what it sounds like. We come together, we play some bingo, we stop and chat about how to do an in-home assessment to reduce falls. We talk about how to be safe in your environment to reduce falls. And then we also do a little bit of exercise, again, to strengthen our muscles, gain that balance and flexibility. Again, these are free to everybody. I'm going to start a Tai Chi class here in this conference center starting in January. So let me know after we're all done here if you would like to register for that. Caveat, it's not a one and done or pop in and out like your classes at the Y. It is 8 weeks long. We meet twice a week for hour-long classes, and we build on that strength as we learn the forms of Tai Chi. Family caregiver support. Here we go. We also know that so many of us are maybe caring for an aging parent, maybe an adult child who has disabilities. And we do it, we love our family, right? We do it out of love. However, we also know it can be stressful. It can be stressful financially. It can be a wild ride trying to coordinate our time, right? So we also support our family caregivers. We have an amazing family caregiver support specialist. Her name is a mouthful, but she is fabulous at what she does. Her name is Teresa Niewiadomski. She provides education, resources. She has support groups available. If anybody is interested in anything she has to offer, please, again, see me after we're all done here, and I will get you her contact information. But we definitely support those who support their loved ones. We also have a foundation arm to us. So as you flip through the brochure, you'll find many of our programs you have to qualify for Medicaid. Not all of them. There is our care coordination program that you don't have to qualify for Medicaid, but many of them you do. So our foundation raises funds to help those people that don't qualify for Medicaid, but then don't quite have enough in their own bank accounts to be able to pay out of their own pocket for in-home chore services or that in-home nurse or medical equipment. So, and we know that's a huge swath of the population. So that's what our foundation raises money for. We just wrapped up our annual raffle fundraising event where we sell raffle tickets to the general public. We have fabulous prizes available to win. Grand prize is 7 nights airfare for 2 anywhere in the US, Canada, Mexico. And the good thing about that raffle, all of the prizes that we have secured are either donated to us or we've secured them using our credit card points. So not one of the dollars that somebody spends on purchasing tickets goes towards paying me, right? Which is very good. We just wrapped that up and we're able to raise over $185,000, and that money goes towards advocating for that population, those people that can't pay out of pocket for services that they need to be able to thrive in their home. We also have a program called Care for a Lifetime that is 100% funded by our staff. And the dollars we raise through that goes directly towards providing services for that population and helping them out and getting them the services they need. So I stood up here for a while and yapped at you, but we have a beautiful video that I think sums it up best. And if anybody has napkins or Kleenex, get ready to use them because this always makes me tear up. But Julie, who you'll see here in a moment, says what we do so much better than I. So I'm going to share this with you.
Hi, I'm Julie. My direction to Direction Home came by fluke. Getting on the internet and trying to find resources for help, or didn't really know if I believed everything that I read online. My very first resource that I did was I went to a luncheon for Medicare because I did not even understand how Medicare worked. I sat with 2 ladies. They had asked me, what I was there for. And I said, my mom was diagnosed with dementia and we were going to take care of her at home. And I had no clue what I was doing. And these two ladies looked at me and said, we're going to tell you what you need to do. You need to call Direction Home. They will help you. They will navigate you through whatever you might need. If they don't have the resource, they'll find the resource for you. I called that number the next day and I was connected with what I call my angel. Allison was my lifeline. She helped me with so many things. You have no idea. They were my saving grace. So I thank you so much for that. Direction Home, they never asked anything of me, but continued to give to me. Like I said, they helped me through everything. They helped me through so much and taught me how important it was to have a social worker in my life and the things that I needed to do to make everything okay. And they did. They did. My life, I don't know what I would have done without them. They're worth every inch of your fingers to dial that phone number, on their website. Give it to them. Let them help you through everything. They've helped me through things with my father now, who since my mom passed, he has fallen, he has broken things, he's been sick. Direction Home came through. They've given him a digital tablet. He's homebound. And even the history that I have with them, 10 years, they're still here for me and I appreciate them so much. Reach out, they're fantastic.
So that is an actual consumer. So you can see just one of the ways that we are able to help people. These numbers and sites are our contact information. You can reach directly out to our Aging and Disability Resource Center. Communications, if you would like us to come out and speak to a group, we're happy to do that. Events, trainings, and education, I'm your girl for that. Caregiver support, there's Teresa Niewiadomski. Do you know how long I had to practice to say her name? I was just talking with her about this a couple weeks ago. I was like, I remember I had been here a couple months and I saw her in the lobby of the building we used to be in. And I was like, so how, for the 15th time, how do you pronounce your name? But I got it now. I can even spell it. Is there something we can help you with, Brian? Good? Okay, good. And then our ombudsman and volunteer department there, if you would like to give them a call, again, for any concerns in a long-term care facility, that's the people you want to reach out to. So I'm going to bring in Francine next. She is going to be sharing with you the Medicare information that you are actually here for. And then following Francine, Jessica Reno is going to talk about, since everything is online nowadays, she's going to share with you how we can avoid online scams. And I really encourage you to stay for that one. Our previous two Medicare seminars, she actually had so many people coming up to her saying, thank you for that information. That was amazing, asking for the slides. This presentation is being recorded and it will be posted to our website. So we understand that all of this is a lot of information. So if you would like to rewatch and review it again, you can go to our website, which it is on the cover of this brochure, the dhad.org. And from there, you'll go to resources and education and then Medicare resources and education. You'll find where this has been recorded. You can also find electronic copies of everything that you've got in your packet as well. So just so you know that. And I would like to bring in Francine now. I don't know if she's in the room or waiting patiently outside. Yeah. Yes. Mm-hmm. Things that I have wrong with me. And somehow I got bypassed and was sent straight down to Q&B to before the nurse had even come out to assess me. And I didn't qualify for any help. Like I can't go to the floor, I'm a walrus. I can't get back up. Are there programs to bypass downtown, like the Medicaid part of it, to assist somebody as they're healing from a bunch of broken injuries? So that would be a question for our ADRC. And if you have time to stick around after this, I can bring somebody down to talk to you. Perfect. Yeah. So, all right, I'm going to pop my head outside and see if Francine's out there. Please hold. Talk amongst yourselves. I feel like I should be a complete hype person. I just saw her. There she is. All right, everybody ready? Everybody give it up for Francine Chuchanis. You don't know how long I've been dying to do that. Admittedly.
We have two people coming in. I'll wait for them to come in. Like I said, there's two people out there. I'm going to wait to come in. They're giving their what they ordered for lunch right now. So I would like to tell you, hold your questions till the end. So if you have a question, you write it down so you remember what it is, and I'll take questions at the end of the presentation. It's a little difficult to do it while I'm talking. I'm getting old. I can't multitask. Well, we're all aging from the time we're born, right? Yeah. Are they coming in? Are the two ladies coming in? Oh, okay. I'm waiting for them. Did you enjoy your commercial by Lori for our services? Yeah.
This is just for my own amusement because I don't get to yap at people very much. Everybody look like you're having the best time ever. Smile. Smile. Woo. Okay, thank you.
Lori's in our communications department. Can you tell? She's got to take pictures and whatever. Okay, here they come. We're waiting for you. Hi. Grab a refreshment, get a seat, and we're ready to talk Medicare. So, for those of you that are not on Medicare yet and aren't sure exactly what Medicare is or what it does, Medicare is national health insurance for people over the age of 65 or for those who have been on disability through the Social Security Administration for 24 months. It is also available to people with end-stage renal disease, Lou Gehrig's disease, permanent kidney failure, and persons eligible for railroad retirement. Medicare is different than Medicaid. People always ask me that question, what's the difference? Medicaid is income-based. It is health insurance for people with lower incomes. So it is just based on income, not anything else. For Medicare enrollment, it's best to enroll 3 months prior to your 65th birthday. That way, your benefits are going to start the first day of the month you turn 65. If you wait to enroll until your 65th birthday or during the 3 months after you turn 65, your benefits will start the next month, the following month. If you're receiving a Social Security check, the government knows who you are and where you live. So they're going to, as soon as you turn 65 and become eligible, they're going to send you a red, white, and blue card that'll say you have Part A and Part B. If you miss your annual enrollment, you can enroll between January 1st and March 31st of each year, and your benefits will begin the following month. There are some special enrollment periods. So we know we've had some national disasters recently. So if someone's impacted by a national disaster, they have a special enrollment period. If you move to or leave a nursing home, you have a special enrollment period. If you lose your health plan or employer insurance coverage, you also have a special enrollment period. And if you're on Medicaid and you lose Medicaid, you may have a special enrollment period to join Medicare. If you're already on Medicare, which I'm sure probably a majority of the people here are, this is the time you should check your coverage and make sure you have the benefits that you need. And this is why we do these sessions during the fall of each year. It is now open enrollment. It's began on October 15th. It ends on December 7th. Please do not call me on December 7th with questions. If you have questions, ask them today, or if you need help enrolling, do it ahead of time. It includes so open enrollment includes all people who are receiving Medicare, even those who also have Medicaid. So people can actually have both Medicaid and Medicare. If you're in a Medicare Advantage plan currently, like SumaCare or Anthem or AARP's plan, one of those, you should have already received an annual notice of change, which tells you how your insurance is going to change for next year. People always tell me it's so confusing. It's so confusing. Medicare just makes me crazy. Well, we're going to try and simplify that today. So really, you only have two choices to get coverage under Medicare. First, you can get traditional Medicare, and that's when you use your red, white, and blue card. The second way you can get coverage under Medicare is to join a Medicare Advantage plan. And those are private plans that contract with the government to provide Medicare benefits. And if you join a Medicare Advantage plan, you will get a specific card from that plan that you will use when you go see your doctor or you need other medical services. There are advantages and disadvantages to both of these kinds of coverage. With traditional or original Medicare, you can use any provider in the United States that takes Medicare. There are no prior authorizations for services, so you don't have to jump through any hoops or ask Medicare to authorize getting a service covered by Medicare. You can add private supplemental insurance to cover the gaps in your costs under original Medicare. And as I said, there's no geographic restrictions. So the coverage is the same across the United States. On the other hand, there are some disadvantages. There's no extra benefits. So benefits like hearing, vision, dental services are not covered under traditional Medicare. There are no out-of-pocket limits. There are some out-of-pocket limits with Medicare Advantage. And you may have to add a separate drug plan if you do not have a drug plan, prescription insurance under your retirement plan or through the VA. Supplemental coverage, which we will talk about in a little bit, can get expensive too. Medicare Advantage does have those extra benefits. So you get the gym memberships and you get the hearing and the vision and the dental benefits through these plans. There are also, I mentioned, out-of-pocket limits. So we'll talk a little bit more about those when I talk about Medicare Advantage. You have to have both Parts A and Part B to join a Medicare Advantage plan. So you're still going to pay a Part B premium. Most of these plans include drug coverage. So you get that coverage all wrapped into one. You don't have to get a separate Part D plan. All of these plans have to cover what traditional Medicare covers. However, some of them require prior authorization. So they make you go through some hoops before you get coverage. There are geographic restrictions. So some plans all plans will cover you for an emergency if you're out of the state. Some national plans will cover you if you spend part of the year out of state. but their geographic restrictions are different. So these plans differ in what they cover in every county. So we cover 4 counties. So I have to do charts for 4 different counties because the coverage varies slightly from county to county. There are also provider restrictions in most of these plans. So you have to generally use their doctors, their hospitals, and any other providers that you might require services from. And you cannot add any supplemental insurance to cover your copays. So we're going to talk about the parts of Medicare. What does Medicare Part A cover? Covers blood, covers intermittent home health care, covers hospice care, inpatient hospital care, and skilled nursing home care. For most of us, we don't pay a premium for Part A. Why? Because you've already paid into the system. So that Medicare amount that came out of your paychecks when you work or were working, that's what it went to. So if you worked full-time for 10 years or your spouse worked full-time for 10 years, you get Part A premium free. But there are deductibles. So when you go into the hospital under traditional Medicare, you will have a deductible next year of $1,676, a little bit higher than it was this year. That will cover you for 60 days of hospital care. If you end up being in the hospital more than 60 days, which is really very rare, you will then have a daily copay of $419. That will cover you for days 61 through 90. And then if you have to remain in the hospital even longer, you can use your lifetime reserve days. You can only use those once. And that you will have coverage for days 91 through 150 at a cost of $838 a day. So it can be very expensive, but of course, this is very rare. Part A coverage in a skilled nursing facility. So people always call me and ask me, does Medicare cover nursing home care? It only covers skilled care. It does not cover custodial care. So if somebody needs help with just bathing or eating, those types of things, those activities of what we call activities of daily living, Medicare doesn't cover that. Skilled care includes physical therapy, occupational therapy, speech therapy, or if you're so medically complex that you need an RN to monitor your care on a daily basis. And that again is also rare. Under traditional Medicare, you need a 3-day hospital stay. That does not include the day of discharge. Observation status does not count. So you're supposed to be told within about 24 hours if you're in the hospital and you think you've been admitted, whether you're really admitted or you're on observation status. If you're on observation status, that does not count for your 3-day hospital stay. Then let's say I'm getting a knee replacement. A lot of us get knee replacements, right? Hit a certain age, gotta get a new knee. You will be covered in full by traditional Medicare for days 1 through 20. After day 20, you have a coinsurance of $209.50 next year. Although the benefit can last up to 100 days, that doesn't mean the benefit does last 100 days. And that's another question I always get. My dad's in the nursing home. He's getting therapy. They're cutting his therapy. I thought it lasted for 100 days. Only under specific circumstances will that benefit last for 100 days. You can get a new benefit started if you leave the nursing home and are not in a nursing home or a hospital for 60 days in a row. When that happens, and let's say something else happens and you fall and you need therapy again, you can go back if you've been out for 60 days of the hospital or the nursing home, and a new benefit will begin. So People who have been in skilled therapy know that at some point in that therapy, the therapy stops, and we're given reasons for that. You should be given a cut letter within 2 days before it stops. These cuts, the stoppage of skilled therapy, can be appealed, but the main question for the continuation of therapy would be, can care be safe and effective without the involvement of skilled personnel? So, in other words, if an aide can do exercise with you and you don't need a physical therapist, that's not going to be covered by Medicare. It has to be done by skilled personnel. And our skilled services need to maintain or slow decline for a specific disease. So those are the two instances when you could possibly win an appeal. And those of us in the Ombudsman program, which is where I work, we can help you with that. So Part A also covers hospice, comfort care, not curative care. That's what hospice is for. It includes services for pain relief. It includes prescriptions for pain relief, aid and homemaker services, spiritual and grief counseling. It does not cover room and board if the person is getting hospice services in a nursing home. It'll cover all these other services, but it won't cover their room and board. And then if somebody is receiving hospice services in the home and the family needs a break, that the person receiving hospital services can go into a nursing home under what we call respite care, and they will have a 5% copay for that stay. Home health care is intermittent skilled care, and it does include aid services. So skilled care would be if you have a nurse coming in to your home to provide a medical service. Then Medicare will cover your home care. If it's not skilled, if somebody's just coming in to help with meal preparation or help with shopping and those types of things, Medicare does not cover that. Also under Medicare, you must be homebound. Homebound does not mean that you can't leave your house. It means that it requires a taxing effort for you to leave your house. So it's difficult for you to leave your home without assistance. You have to be under the care plan of a doctor, so you have to see the doctor face to face. Doctor has to certify that you need home health services. And home health can also include social services. So that's Part A. Part B covers things like doctor office visits, preventive care, durable medical equipment, ambulance services, and some professionally administered drugs. And those are drugs that have to be administered in a physician's office. Everybody pays a premium for Part B. So the premium's going to vary depending on when you entered Medicare. For 1985, the premium is going to increase to $185 a month. That is up from what it was this year, which was $174.70. This increase is tied to the cost of living adjustment in Social Security. So those of you that are receiving Social Security benefits will receive a 2.5% increase in your Social Security check beginning in January. With Part B, there is also a deductible. So you have to meet this deductible before Part B coverage kicks in. So let's say you're going to visit your physician. You're going to have to pay the first $257 in 2025 before Part B kicks in. And with Part B, you always have a 20% copayment. The copayment is generally waived for preventive services, things like mammograms, things like the flu shot, the COVID shot. That 20% is waived. Part B and D D is for drugs. They're also income adjusted. So if you're fortunate enough to make over $106,000 a year if you're single, or $212,000 a year if you're married, you will pay more than that $185 a month. It will be income adjusted on a sliding scale. Some people can delay Part B. So if you or your spouse have medical insurance that is primary to Medicare, that means that that insurance pays first through a current employer, you can delay enrollment in Part B. So I have insurance through Direction Home Area Agency on Aging, and I like my insurance. So I delayed Part B. I don't want to have to pay a premium for Part B on top of whatever my employer asks me to pay for my insurance. If you do this, you must inform the Social Security Administration. You also need to make sure that you get a letter from your employer stating that you have creditable coverage. Because when you do go to join Part B, get Part B, you need to show that you actually did have creditable coverage or coverage that was primary to Medicare. And most of the time, if a company has more than 20 employees, their insurance is going to be primary to Medicare. If you're covered by COBRA or you lose your employer coverage, you have 8 months to join Part B. Now, COBRA often covers people for 12 months. So people think, oh, gee, I took COBRA, so I don't have to get my Part B until after COBRA ends. That is not true. You need to enroll in Part B within 8 months. There is a late enrollment penalty for Part B if you do not enroll when you're supposed to. And that penalty is 10% of the average premium for each month you were eligible and did not enroll. And that penalty will last a lifetime. You'll pay it forever. So people need to make sure they're enrolling in Part B when they need to. So as you can see, there are a lot of out-of-pocket costs with Medicare, especially Part A. So to cover those costs, people purchase what's called supplemental insurance or Medigap insurance. This is not a Medicare Advantage plan. Medicare Advantage plans are not supplemental insurance. They're just another form of Medicare. So in your packet, you have a chart that looks like this. This shows the types of Medigap plans that are available and what they cover. Note, Medigap plans, again, have no extra benefits. They only cover what traditional Medicare covers. So there's no hearing benefit, there's no vision benefit, nothing extra. So be aware of that. The best time to join a Medigap plan is the first 6 months you enroll in Medicare. Why is that? Well, it's because they can't ask you about pre-existing conditions and they can't turn you down. They have to cover you in the state of Ohio. After that time, they can ask you about pre-existing conditions and they can charge you more for coverage because they're going to underwrite it. That's what insurance companies do. If something's wrong with you, even if it's something simple as a thyroid issue that you take Synthroid for, it's a pre-existing condition. They're going to underwrite you. So the best time to join is within 6 months. You have to be 65 in the state of Ohio, and you have to have both Parts A and Part B. Now, there are a lot of companies that sell these plans. And just like car insurance or homeowners insurance, you got to check the prices for these. So let's say I choose Plan A. At Company X, it might cost $87 a month for me to get Plan A, supplemental insurance. But at Company Y, it might cost $140 a month. So you have to compare costs, even though the coverage is the same. And these plans are standardized throughout the United States. So whatever plan you choose in Ohio is going to give you coverage in California. So they're standardized throughout the entire United States. Plan C and Plan F are only available now to people who joined at least Medicare Part A before January 1st, 2020. They are no longer available to new enrollees in Medicare. However, if you have one of these plans already, you are grandfathered in and you can keep it. I talked about the underwriting first 6 months. I had a lady call me yesterday. I felt so bad about it. She said, her husband has become ill. I want to get a supplemental insurance plan. Her husband has traditional Medicare. And I said, is your husband new to Medicare? No, he's had Medicare since 1986. Does he have pre-existing condition? Yes, he has a lot of pre-existing conditions and he's very ill right now. I said, well, you can call some companies, but I can tell you they can deny coverage. And if they do cover you, they're going to do some underwriting. So it could be very expensive to get one of these plans. There are what we call Medicare savings programs. And these are programs that can help people pay for their premiums and their co-pays under Medicare. In your packets, there is a brochure that gives you the income limits for these Medicare savings plans. There's QMB, SLMB, QI, and QDWI. Income limits for each of these is a little different. And they also look at resources, cash on hand, stocks, those types of things. And so if you or someone you think might qualify for these programs, it's well worth their while to apply. And they can apply by calling our 800 number, or they can call the Job and Family Services in their county, and they will send them an application. So we covered Part A and Part B. We're going to skip Part C for a minute, and we're going to go to Part D. Part D is prescription drug coverage. Part D is included with most Medicare Advantage plans. If you have traditional Medicare and you do not have creditable coverage through the VA or through a retirement plan, you will need to get a separate Part D plan. Now, those plans are listed in this chart that you have in your packet with the green heading. These are prescription drug plans. If you have coverage now, you want to make sure you get a letter from your retirement plan or from your employer that says your coverage is creditable. And there's a reason for that. And I'll get to that in a second. So you want to make sure that you have a letter. You want to make sure, again, that you enroll in one of these plans when you become eligible. I don't care if you don't take any medications. If you're on Medicare and you get sick in the middle of the year, you can't get one of these plans. So you have to do it during open enrollment. If you don't and you want it later, again, you're going to be penalized 1% of the national base premium for each month you did not enroll and you were eligible. And in 2025, the national base premium is going to be $36.78 a month for these plans. So remember, you cannot enroll mid-year. So every year, the government comes out with what they call a standard benefit for Part D. So in 2025, the initial deductible can be as high as $590. That's the annual deductible. So in some plans, you can pay as much as $590 as a deductible, or you can pay less, but they can't have a deductible that's higher. The good news is that donut hole that we used to talk about, it's gone. It is now gone. So what happens now is that when people's drug costs reach $2,000, they don't have to pay for their drugs anymore. So you're going to pay about 25% of your initial costs for your medications. Some are going to be free, but 25% up to $2,000. And then catastrophic coverage kicks in and you pay zero for your prescriptions. Now, the reason I said you need a creditable coverage, I said to our HR, hey, because there's that $2,000 limit, I wanted to know, we don't have a limit for our prescription insurance. So I needed to know, is it creditable? And there's some kind of fancy way they figure that out. So you want to make sure you have creditable coverage. I will say that this is part of the Affordable Care Act. The Affordable Care Act goes away, this goes away. But right now, that's what it stands. So, the Medicare prescription payment plan. This is new also. So, not only is there a $2,000 cap, you can spread your costs over 12 months. So, if you have high prescription costs and they come to $2,000, you can pay that over the course of 12 months. And you can ask to be billed by whatever your prescription drug plan is. So that's a good thing. So these standalone plans, the government told them that for 2025, they could not increase their premiums more than $35 per year. And that was called the Premium Stabilization Program. You will note that if you look at, especially these Part D standalone plans, many of them do have that $590 yearly deductible. We also saw a reduction in the number of Part D plans overall. And we also saw fewer plans that serve people who qualify for extra help. And this is another program for people of lower incomes, where they can get extra help paying for their premiums and have lower prescription costs. This also could go away. So when you're trying to decide, how do I pick a Part D plan? How do I pick prescription coverage? And this goes for whether you're picking a standalone Part D or you're in a Medicare Advantage plan. You want to look at, are all my prescriptions covered, of course, and how much am I going to pay? You also want to look at whether there are restrictions. Restrictions can be, do I need to get prior authorization for this prescription? Are there quantity limits? Usually the quantity limits are for narcotics. And then you want to look at whether there's step therapy. And what that means is the insurance company wants you to try a cheaper drug before you try a more expensive drug. That can be appealed if you've already tried cheaper drugs and they didn't work, and that's why you're on the more expensive drug. Your doctor, your physician can do those appeals for you. I just got notice that my insurance is no longer going to cover my levothyroxine. So we get like 3 months supply. So I'm like, okay, I'll go to the drugstore and get it. And get it through another source. So you want to make sure all your prescriptions are covered. You also want to look at the pharmacy network. So if you use the Medicare website to do an analysis, it's going to ask you, what pharmacies do you go to? And usually, if I'm looking for my family member, I'll click on mail order because I want to see if it's cheaper if you get it by mail. And then I'll click on 2 other pharmacies that they like. And it's funny, but the cost that you're going to pay for your prescriptions is going to vary by pharmacy. So you want to make sure, even if it's in network. So the first thing you want to make sure is my pharmacy in network? So you go to the pharmacy and you say, do you take my insurance? And they say yes. That's not what you want to ask them, because they take most insurance. What you want to ask them is, are you an in-network pharmacy with my insurance? But it was interesting that even on the in-network pharmacies, there was some differences in how much you pay for the same prescriptions. So it's really a good idea to look at that closely. And then you want to look at the star ratings. I don't recommend that people ever join any type of plan that's rated less than 3 stars. So the highest star rating is 5. 3 out of 5 is okay. Anything less than that, buyer beware. Something has caused them to get a lower star rating. And you can look at that on the Medicare website too. So why did this plan, where did they rate lower? So the star ratings include things like number of member complaints, number of members who left the plan, the plan providing accurate drug pricing, the ease of filling prescriptions, and changes to the plans mid-year. Because did you know, unfortunately, these insurers are allowed to say, oh yeah, I told you we're going to cover your drug. But then in the middle of the year, they decide they're not going to. So you have to look for another one. Extra help. This is, again, you have a brochure in your packet. So if you or someone you know qualifies for extra help, it has been expanded for 2025 to include people below 150% of the poverty level. They will pay 0 premiums and no deductibles in plans with premiums less than $39.30 in Ohio. They'll have reduced copays for generic and brand names. They can apply for this program by calling our 800 number or by going online to the Social Security website. Social Security is the one that administers this particular program. So check your prescriptions yearly. There's significant differences in prices. When I go on the Medicare website, if I even look up Synthroid, there are significant differences in prices from plan to plan. You can do an analysis by going to the website or having someone you love who's very good on a computer do it for you. You can call Medicare or you can call the Ohio Senior Health Insurance Information Program, OSHIP. And they have trained Medicare counselors who can assist you. So now we're going to go to Part C, and Part C is Medicare Advantage plans. So as I mentioned earlier, you have to have both Parts A and B to join a Medicare Advantage plan. Most of them include drug coverage. If they do not include drug coverage, you're going to need to get a standalone plan. Most of them have out-of-pocket maximums. Some have 0 premiums. Most of these also do not require a 3-day hospital stay to get rehab services in a skilled nursing facility. But there are provider limitations. So in your packet, you should have charts that look like this. I think we gave you Summit and Stark. If you need others, if you need Portage or Wayne, we have those available. So if you look at the chart, I've listed all of these plans in alphabetical order. I've given you their star rating. We don't have any 5-star plans this year, but there are a number of 4.5-star plans. It'll show you the premiums, whether there's a health deductible, and that would be a yearly deductible, and it does not include drugs. It'll tell you whether the plan includes drug coverage, what the yearly drug deductible is, what your copays if you go to your primary care physician, and there's a lot of 0 copays on those. And then whether you have doctor choice. So if it says HMO, you don't have doctor choice. That means you have to go in network. If it says HMO POS, that means your primary care physician can refer you, but you can't refer yourself. If it says PPO, that's a preferred provider organization. And with those, you can usually go out of network, but you may pay more for those services. You'll also note that the last pages of these charts, pages 8 and 9, those are the plans that do not include drug coverage. So I separated those out for you so that you know that they don't include drug coverage. And then you'll see the maximum out-of-pocket limits. So once your medical expenses, not including drugs, hits that maximum out-of-pocket limit, you wouldn't pay anything more for your medical care. If you have very complex medical needs, you want to pay close attention to those numbers because they can vary. You can see they can vary from $4,500 or $3,900 up to over $10,000. So pay attention to those out-of-pocket limits. These plans, as I said, they contract with Medicare. They are a form of Medicare. Just like traditional Medicare, these are another form. This is a second type of coverage you can get. They are not supplemental. You cannot add supplemental coverage to them. If somebody sells you a supplemental plan, and they're not supposed to, by the way, but if they do, you will lose your Medicare Advantage plan because you can't have both. If you join a Medicare Advantage plan and you decide you don't like it or you want to change to another plan, you can switch to another Medicare Advantage plan or go back to traditional Medicare from January 1st of each year until March 31st. So that's only if you are in a Medicare Advantage plan. So a lot of people love these plans because you get all these additional benefits. You get a fitness benefit, gym membership, telehealth, even cash cards. Those are very popular. You get dental, hearing, and vision. What I will tell you, though, is the more extra benefits you get, these are insurance companies, folks. They don't give you something for nothing. They're giving you something over here, and somewhere over here, they're taking something away. So you want to look closely at the benefits of these plans and make sure you look at the cost of the benefits that you use the most. Selection considerations, as I said, focus on the services you use most. So if you're a person that really doesn't see a primary care physician very often, you go to a bunch of specialists, you want to look at what you're going to pay to go to the specialist. And I saw those costs range anywhere from $25 a visit up to around $45 a visit. You want to look at whether your prescriptions are covered, the networks, extra services. Are your doctors in the plan? There are some companies, like if you look at Humana, they have like numerous plans. It drives me crazy trying to do this chart every year because they don't even change the name of their plans. So I have to pay attention to every little detail when I'm doing the charts. So there might be only really subtle differences between the plans within a company. You want to look at the star ratings, and then you want to take into consideration the plan's reputation. And that's not what your neighbor Mildred is telling you she's on, and that this is so good and you ought to join this because I'm in it and it works great for me. You have to go by what services you use, what services you need, not what Mildred has. The other thing you need to do is, and this is a good indicator of the plan's reputation, is call your doctor's office. And you want to ask them, do you take this plan, number one? And then you want to ask them, if they do, what's your experience with this plan? And they might tell you, oh my gosh, we have to do prior authorizations for everything. They take so long to get back to us. Your doctor's office will tell you their experience with the plan. So the Medicare Advantage plan star ratings include how many of the members got preventive benefits. So that's a big deal to the federal government. Did people get their health screenings? Did they get vaccinations? How many member complaints were there? How many appeals were there? How many people chose to leave the plan? And did the plan do a good job of giving their members the information that they needed? And all of those things you can look at in the Medicare website also. So regarding local changes to Medicare Advantage plans, our premiums in all 4 counties remained relatively stable. We still have numerous choices. I mean, almost too many choices. There were, however, increases in out-of-pocket limits in many plans. So what I do every year is I take this chart and then I write over it the changes that happen with all the plans so I can see what these insurance companies are doing. And so they may give you a lot of benefits, but one of the things they did was they increased that out-of-pocket limits. There were also increases in the yearly drug deductibles in plans. Some plans didn't even have a yearly drug deductible this year, and they added one for next year. And then some plans actually reduced some of their extra benefits. There are also a type of Medicare Advantage plan, which I don't do a chart on these. These are special needs plans. And these plans cover people with chronic conditions. So there might be a plan for people who have diabetes, for instance. There are special needs plans for people in nursing homes. There are special needs plans for people who have both Medicare and Medicaid. These plans have 0 premiums. The benefits vary widely and should be compared. A lot of these include transportation and fitness benefits. I will tell anybody in the audience who is on MyCare Ohio, if you join a special needs plan for 2025, you may have problems with billing because your Medicaid plan, whether it be CareSource or United, does not coordinate well with these special needs plans. And I had 2 calls yesterday regarding this for people who did it this year. You should also be aware that in 2026, those individuals who qualify both for Medicare and Medicaid in the state of Ohio will be placed in special needs plans. And the state has selected 4 of those so far. That we don't have a lot of more information about that yet. So right now, people who have both Medicare and Medicaid have to choose either CareSource or United for their Medicaid, but they can opt in and choose the plan for their Medicare too. And that's when there's coordination. But they can also choose to opt out and join any other type of Medicare coverage they want, whether it be traditional Medicare or a Medicare Advantage plan. So these are, again, 3 ways you can analyze your costs and coverage. You can go to the Medicare website, you can call OSHIP, you can call Medicare, and they will assist you. Choose wisely. Remember, you can only switch during certain times of the year. It's now open enrollment. Again, if you're in a Medicare Advantage plan, you can switch it. You can switch that between January and March. This year, duals, people who have both Medicare and Medicaid, were only allowed to change their plans quarterly. Next year, that's going to change, and they will be able to get in and out monthly, but there are going to be limitations to that. Marketing guidelines. So, how many people's mailboxes are just getting jam full of plan information? Throw it away. Unless it's your plan and unless you've done an analysis, those brochures, they're meant to get you going on whatever plan they're selling. So there are marketing guidelines. These plans are not allowed. The ads on TV that you're seeing, God, I can't wait till those are done too. They're not allowed to mention a specific plan unless it is a specific plan. So these numbers that say, call us and we'll tell you which Medicare Advantage plan, you're best suited to. All of those companies, they're supposed to tell you what plans they represent. So it's okay to see a commercial by Humana because Humana's representing themselves. But these other places that say they're going to help you, they don't represent all the plans you see on that chart. They only represent certain ones. And none of these ads in print or on TV are allowed to say they're the best, they're the most. Nobody's allowed to do a cold call at your house. They're not allowed to knock on your door and say, hey, I'm from such and such a plan. Can I sit down and talk to you? And the brokers have to tell you when you do sit down with a broker, and there's nothing wrong with that. There are some good brokers. They must tell you which plans they represent. And if you change your coverage, this year, brokers have to tell you how that affects your current coverage, how that affects your doctor choice, your pharmacies, your medications, and your medical costs. I want to mention, as an ombudsman, I have to tell you there are appeal rights in Medicare. You have the right to appeal coverage and payment denials for covered services. Appeal process is slightly different for Medicare Advantage and for traditional Medicare. Prescription appeals, again, should go through your physician. You should also know that prior authorizations by Medicare Advantage plans are now being monitored by Health and Human Services. They found that sometimes these plans were requiring prior authorizations and denying services when they shouldn't have, because Medicare Advantage plans have to cover everything that traditional Medicare does. And now, if you find out that you were told that you're admitted to the hospital, and then all of a sudden your status was changed to observation status, you have the right to appeal, and the appeal steps have just been published. So in other news, the Hospital Insurance Trust Fund is said to be solvent right now until 2036. Again, this changes with a lot of different things, but that's what they're saying now. Part B and Part D, they remain financed adequately because we pay premiums for those parts of Medicare. Just for your information, in 2023, $848 billion were spent on Medicare beneficiaries. That represents 3.6% of our gross national product and 13.7% of the federal budget. Under the Inflation Reduction Act, all recommended vaccines are to be covered at pharmacies. There is a $35 copay limit for insulin, and it may be less. It may come down in 2026. We talked about that $2,000 per year Part D out-of-pocket limit. And Medicare has begun negotiating prices with of certain drugs. So I think I have a list of those. So they selected 10 drugs to negotiate prices with pharmacies, because that's what the Veterans Administration did. So people said, well, if the Veterans Administration could do it, then why can't Medicare do it? So in 2026, they have negotiated prices for Eliquis, Xarelto, Januvia, Jardiance, Enbrel, Imbruvica, Farxiga, Entresto, Stelara, Fiasp, and Novolog for diabetes. So as the act stands, the list of price negotiations is supposed to increase to 15 drugs after next year. Again, we don't know if these acts are going to stay, but this is what it is right now. There are legal battles and other advocacy efforts going on. So the Center for Medicare Advocacy is suing Medicare because for violations of federal law protecting beneficiaries' rights to home health. So here's what happens. Home health agencies are paid more for serving people who come out of hospitals rather than people with chronic conditions who also need home health. So a a lot of people are being denied home health based on cost. So the Center for Medicare Advocacy is suing the government. And guess what? Pharma is suing the government under these price negotiations. So they're saying that the government doesn't have the right to negotiate prices for medications. I talked about the appeals process addressing hospital observation status. If your status was changed from inpatient to observation status, you do have the right to appeal. And also next year, anybody who's in a Medicare Advantage plan is supposed to receive a letter by the middle of the year telling you you have unused benefits. So here's what happened. You know, all those extra benefits, including like cash cards. Sometimes they don't just send them out to you. You have to ask for the benefit. So you have to call and say, hey, I didn't get my cash card. Well, now they have to tell you you have an unused benefit. So that's a good thing, especially with those cash cards, I guess. And with that, I have no more to tell you, at least right now. So I'd be happy to take questions. Yes, sir. Well, we have a new administration coming in who said that they wanted to appeal the Affordable Care Act. So some of the legislation that has gone through under the Affordable Care Act could disappear, or they could choose to just eliminate certain parts of the Affordable Care Act. I have no idea, you know, if that'll happen or they're saying that, but heaven only knows. I mean, my only point to a Medicare beneficiary is to watch what your legislators are doing. And if you don't like what they're doing, get on the phone and write letters. Yes.
They seem to do the same thing, except the costs are different, and then the out-of-pocket
The difference is in the benefits, the overall benefits. So what you would pay, so with Medicare Advantage plans, let's take a hospital inpatient. They usually say for days 1 through 5, you pay X amount of dollars. So that dollar amount can be different in all those plans. Well, the out-of-pocket includes all medical expenses that you would incur in a year. So that's why I say look at all the benefits that they have, and it'll be listed out in the Medicare website, and see what those costs are for the services that you use most. Yes, sir.
Medicare from the Medicare Advantage program, or you've always had a Medicare Advantage program.
Uh-huh.
You want to go through it. You go through the proper time frame to do it. Can that, I guess, kind of supplemental plan that you might want to pick up since you have traditional again? Can they rate you or charge you or turn you down because of the reasons you mentioned?
Yes. If you've always had a Medicare Advantage plan and then you want to go back to traditional Medicare, yes, supplemental plans, a company can turn you down or underwrite you based on any pre-existing conditions. Yes, sir.
On the section on the Medicare Part B medical coverage, there's a line there that says covers observation status hospital stay.
Okay. Yes, thank you for pointing that out. I skipped over that one. So under Medicare Part B covers observation status in the hospital. If you're admitted, Medicare Part A covers you. So if you're on observation status, you're going to pay more because you're going to be responsible if you have a deductible that you haven't met and 20% of that hospital costs on top of any prescriptions they gave you in the hospital. There is some coverage, though limited. Yes.
So when I turned because I happen to be Medicare with QMB.
Okay.
To go on one of these plans, I am not seeing where, because I have to have, say, 4 to 5 MRIs a year.
You're fully covered if you're QMB.
I know that, but to go into these ones because of the cash card or because you get dental and stuff like that, what I'm understanding is that all those MRIs, all those CAT scans, everything that I have to go through all the time is all gonna have to be, pre-authorized.
Probably you will need prior authorization. Yeah. Anybody else? Yes.
Like, I get a lot of phone calls regarding Medicare. And how do I get them stopped?
Are you on the do not call list? You need to check that because you have to redo it every so often. Yes. 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 So this is a good question. So if you're working and your income's going to go down and you know you're going to retire, and some of these premiums are income based for Part B and Part D, what do? There's a form you fill out in Social Security and tell them that you're retiring, and I think they ask for an estimated income. Yes, sir.
And one contractor approved medium double test, another contractor does not approve the test himself. So I appealed, I lost and I won. I lost the appeal, but the hospital did not respond. And if the hospital doesn't respond, I think it's 10 days, then I didn't have to pay. So it turned out good for this
Good.
situation.
That is an odd situation. They covered part of it, but not all of it. Yes.
Not covering a lot of the country, but many Medicare Advantage programs do. Found that to be the case.
Yes. So traditional Medicare will cover you in emergencies, I believe, in Mexico and Canada. Medicare Advantage plans have to cover emergency services. But I always tell people they should get medical insurance. If you're going on a long trip out of the country, I get insurance. Yes. Yes. You can call our agency anytime and ask for information. Well, we can't, if you're going to the hospital for something, we can't tell you what they're going to charge you. We don't have that information. That you should get from your provider. Yes, how many days you can stay, yes, and what it's going to cost, yes. Yes, you may change in January till the end of March. You can change from your existing Medicare Advantage to another Medicare Advantage or go back to traditional Medicare. No, the underwriting is just for supplemental plans. You cannot get supplemental coverage with a Medicare Advantage plan. It only goes with traditional Medicare. Yeah, that goes with traditional Medicare. So if you decided to go back to traditional Medicare and you wanted a supplemental plan, they can ask you about pre-existing conditions and they can do the underwriting. Yep. Correct. Anybody else? I'm scanning the audience. Yes, ma'am. No, we don't have details on those individual plans. They are in the Medicare website, or you can find some of it in your Medicare and You handbook. That would take a massive amount of time. Yes, sir. So, yeah, supplemental plans are the same as Medigap. They are not Medicare Advantage plans. Medicare Advantage plans are not supplemental plans. Anybody else? Okay, well, you're always, if you have other questions, feel free to call me and I'll be glad to answer. Just call our 800 number and ask for Francine. I'm the only Francine here, so they know. And if you have other questions, I will be outside for a little while, but I will have to leave. I have a Medicaid hearing that I have to be at, so thank you.
Okay, so can we give Francine another round of applause? She's great at this. So I won't keep you long because I know we're all hungry, but we really want to get you this really important information regarding scams and protecting yourself. We really see it as something that, compounds each person we can tell it to. You now are empowered to protect yourself, and now you can tell your community around you. So I won't keep you long again. I am Jessica Reno. I work with Direction Home. I'm a digital navigator, which essentially means I help people with technology. So we're going to dive right in. So I want to start with scams don't discriminate based on your age. If you'll look at these numbers, it covers reported frauds and losses by age. So that is, a little bit based on who specifically is reporting. But you'll see that the number for both identity theft reports and frauds and losses by age is highest for ages 30 to 39. While they do target, specific areas and those who may be vulnerable, it is not based on age. So today we're going to cover a little bit of some of the terms that you hear, the types, Medicare information specifically, excuse me, and we'll go over some examples and then we can leave the questions to the end. So essentially, an online scam is deceptive activity where scammers attempt to steal personal, financial, or confidential information. They are on the rise. In 2023, the reported online scams increased by 40%. So those losses exceeded $10.3 billion in the US alone. Again, that's based on reports, so we know that number's higher. So it is important to protect yourself. Prevention is key, but we will talk later a little bit about reporting. So again, for 2023, the top frauds, according to the FTC, is imposters. So that is, of course, anybody pretending to be someone that they're not. Online shopping and negative reviews. With online shopping, we recommend you be careful, which we'll cover a little bit soon as well. But we recommend being careful because there are shops online and it appears, you pay and you should get this item. Sometimes it's not a real shop. So now they have your information, you paid, but you're not going to get that item. So you really want to look at reviews. But while you're looking at reviews, you want to pay attention to what it's saying because sometimes there's links in the reviews or sometimes there's false information to lead you to another site like, oh, well, I bought this product and it was way better. So you want to watch what you're clicking. Sweepstakes, prizes, lotteries. I'm sure we've all seen something where you're like, you want $1 million. We just need your information. If it's too good to be true, it probably is. Investments, businesses, and job opportunities. So these were the top ones. We saw a lot of business and job opportunities, especially in 2020 when, we were switching to working remote and things like that, because they do need personal information to apply for a job. So you want to, again, pay really close attention to who you're sharing your information with. And we'll go over some tips for protecting yourself a little later as well. Some types of scams. So phishing is a term that we've likely heard. Essentially, they're sending out some bait to see how many people, will respond to it. So this can be through email, text messages, phone calls. A lot of times it's, and it looks like it's coming from a legitimate source like Amazon or Facebook. And it'll say, for an email, it'll say, your account has been compromised. Click here to sign in and fix it. And we'll go over some of this later, again, for the rules, but it'll look like it came from a legitimate site, a legitimate business, but it's not. There's also fake shopping sites, which we kind of covered. Tech support. This was essentially, more common for computers and laptops. So there's a pop-up that says, your device has been compromised. Click here or call this number to talk to someone to help you. Windows is a very large company. They are not monitoring your device that closely. Out of the kindness of their hearts, they're not saying, call us, something has happened and we'll help you. There are legitimate IT services. There are protection services. These are things that you pay for to have extra, monitoring and things. And then, of course, online social media dating, romance scams. As much as, we hear people giggle about this, it really is, the isolation that can come with not having access, being alone. It is a real thing, and people do prey on that. And it can be, more of a longer term. It's not someone messaged you and says immediately, I love you so much, send me money. It really is, they know what they're doing. So you do want to pay attention and really protect yourself and your loved ones as well. And then, of course, impersonation, which kind of goes along those lines as well. But the important part of the impersonation is social media. So like the example before, if you got an email, it looked like it came from Facebook and it said, it has been compromised, click here and sign in. So when you click it, it looks like you went to Facebook and then you log in. So now that site that was not Facebook has your Facebook login and password. And now they can log into your Facebook. So the benefit of that is a lot of people cannot message other people. Even if they can, a lot of people are ignoring messages from those they don't know. While if someone is getting a link from you or a request, I'm really trying to get to work, can you send me $20 from your Facebook? They may think it's you. So that impersonation. I heard a really good tip on this, that if you have a password or a code for your family, just as that added layer of protection. So you get a message and it's like, I really need $20 for gas. My car's running out of gas. Of course, you want to help your family. In that circumstance, you could say, what's the family password? And if they can't respond with that, then it's just that, just one extra question before I send you some gas money. Okay, so Medicare fraud specifically is when someone intentionally lies or misrepresents information to get unauthorized payments from Medicare. This includes billing for services not provided, unnecessary treatments, or using someone else's Medicare number to file false claims. So one of the biggest ways to protect your information with this is to protect your card like you would protect your Social Security card. You don't want to have it laying out on your counter. It's not necessary to carry it around all the time in your wallet, just in case. Of course, when you need it, you do want to have it with you, but just don't have it, nonchalant. You have it on your coffee table and anybody can see it. So scammers are targeting seniors by exploiting the Medicare system. I heard the question at the very end of Francine's about getting so many calls. They actually recommend not answering phone numbers, calls from phone numbers you don't know. Because I heard the FBI speak on this, and they said if you answer a call and it's a robocall, it's the scammers, they now know that there's a person on the other end of that phone. So it wasn't to, a business, it wasn't to a fax machine, it's a person that will answer the phone. So they put you on what the FBI calls, or maybe the scammers call, like a dummy list. So they're like, here are the people that will absolutely answer because it's a numbers game. So the more people they can talk to, the more likely it is that someone, will share some information. So they recommend not answering calls because unfortunately, while the do not call list does work, those following the rules are just the legitimate companies. So if you're on the do not call list, then you can know that the legitimate companies who follow that rule are not contacting you. Yes.
No, is that legitimate? They said the numbers were all compromised and they were sending out new cards.
So she said that they got new cards because they heard that their numbers were compromised. So Medicare sent out new numbers. I would not know person by person, but you could call Medicare. The number will be in a couple slides. I saw a few head nods, so it's been a few of them, yes. You could always call them. You're initiating that call, so it's, you are the one calling them to reach out. You can call them and ask just to verify. The other important part is that scams don't only come from one place. It's not always email. It's not always a text message. It's not always a phone call. It can be, in your mailbox. It can be someone knocking on your door. So we will have rules here in a few slides of like really the overarching protecting yourself. But it's important to know it's not just from one source. So red flags for Medicare scams, unsolicited calls or offers. They will not call you if you did not request them to call you. They will not send you mail if you did not request that. So unsolicited calls or offers, fake Medicare representatives, that could be somebody also knocking on your door. They are not supposed to be knocking on your door if you didn't ask them to do so. Unusual billing notices, always review your notices. Fraudulent mail offers, maybe they're guaranteeing a specific number or a specific amount of coverage. That's not really something they can blanket statement send out to folks without some information. And then some online scams. So we do have a short video. Maybe.
Scammers are after your Medicare card, so here are the warning signs you may be a target and ways to avoid the Medicare card scam. Warning sign number 1, you get an unexpected call from someone claiming to work for Medicare. Actual employees will never call you without being invited to do so. Warning sign number 2, someone threatens to cancel your Medicare coverage unless you provide personal information over the phone. Warning sign number 3, you get a bill from a hospital or medical provider for care that you didn't receive. Don't share your Medicare or Social Security number with anyone who contacts you out of the blue by phone or email or shows up unannounced at your door. Don't believe a caller is a Medicare employee simply because he or she knows some information about you. Scammers do their homework. For more tips on how to avoid scams, go to aarp.org/FraudWatchNetwork and make sure to tune in to RFD TV the third Thursday of each month for Rural America Live with AARP.
Perfect. So just to review, they will never call you uninvited or ask for personal information over the phone if you did not ask them to contact you. Yes. I don't know. That's a good question. I'll have to ask if that's in the same section that you would access this information. I'm sure we could put it in there if it's not. Perfect. Okay. I can check. If you do get a call and they're talking about Medicare and you did not ask them to contact you, or even if you did, you can hang up and call Medicare directly at 1-800-Medicare. They're not going to be angry if you say, great, I'm going to call you back, just to verify who they are. Always check your statements, report any discrepancies. And again, they'll never ask for personal information by mail unless you contacted them first. Okay, so we're going to get into some overarching rules for protecting yourself that really covers all of the scenarios, whether it's text message, phone, anything like that. We call them DIG rules, just to keep it short and sweet. The first one is don't talk to strangers. It's a classic for a reason. If you don't know me, don't tell me all of your personal information, your social, your address, phone number, things like that, unless you have verified in some way that they're legitimate. The I is if you don't know, don't act. So don't let an implied sense of urgency rush you into giving information. They want you to feel excited or feel scared so that you will rush into sharing information. You won't have the time to check with someone and say, is this legitimate? You're in a hurry or you're really excited that you won something. And that way they can, talk you into things faster. And also, if it's too good to be true, it probably is. The G is really the overarching biggest prevention for you is go directly to the source. So if your bank calls you and says there's fraudulent activity on your account, we need you to verify these, this information or these purchases. You can say, great, I'm going to hang up and I'll call you back. So you don't call back the number that called you. You call your bank at a number on a check, a statement, a number you have saved that you've used before. You can go to the bank directly if that's available as well. Because if there is an issue on your account, they can still see that. It doesn't matter who you're talking to. They can pull it up and they can see it. And you are the one that initiated that call. Same with if you get an email and it says your Amazon account has been compromised, log in here to fix it. Ignore the email and just go to your Amazon app, the Amazon website, whatever you usually do. If you don't have an Amazon account, then you can absolutely ignore it because it wasn't for you. We kind of already covered the first one. Scams can come from all places. Just an example, if someone knocks on your door and says, I'm with the Humane Society and it's the Christmas season, would you like to donate some money so we can get some food for the animals? Of course, a helping heart, you want to give. That sounds like a great cause. They may be just saying $5 donations. Just go to the source, use your rules, and give it directly to the Humane Society. Obviously, they're not going to be upset regardless. If you give it directly to the Humane Society, they would love that. But if it's something you do want to do and someone's knocking on your door, just go to the source and protect yourself. Always stop and take a breath and verify. So if there's someone that you can reach out to, if there's some way you can verify an issue with an account or going directly to the source, if you need to call Francine and ask her, always take that step in between. They want you to rush. And then it's important to note that government agencies do not ask for gift cards for payment. The IRS really likes snail mail. They're using the mail. So they're not calling you to say there's this warrant and you need to send me gift cards immediately. That's not the IRS. So always, take a pause. Some tips for recognizing some common scams. If it's an email, text, robocall, they often use automated technology. So if you answer and it's just, a recording talking to you, it could be a reminder for a doctor visit and you don't really need to do anything. It's not asking you for your social or anything crazy. It could also be a scam. So the goal is if they send out, 15,000 text messages and it says, Tim, your account is past due. You might not be Tim, so immediately you're like, that's not for me, it's probably a scam. But how many Tims probably got the message and they might look at it a little longer. So they're just playing that numbers game. If you engage, you will be connected to a live scammer in some way for them to really try to work that information out of you. The video did say how they do their homework. So if they've gotten into your Facebook account, they may know, your pet's name is this because you're posting your dog. They're doing their homework and they want to do anything they can to seem more legitimate. So that if they have enough information about you, you may feel like, okay, that is who they say they are and I can share this. It may contain mistakes. So there could be some misspellings. If it says it's from Walmart and it's WALL Mart, I think Walmart knows how to spell their name. But it may not. So that's just one of the things you can look for. It creates a sense of urgency. So we have covered this, but you want to really look at that inflammatory language. It's urgent, or there's a timer on the screen. In a hurry, we want you to click this, or you've won this, but only in the next minute. You have to click here, be the first. All of that language is trying to create some type of feeling in you to make you act. If you're asked to verify sensitive information, download something or make purchases, these should throw up red flags. You don't want to download things if you don't know what the source is. You don't want to click on links that you're unsure of. And a lot of times when you're asked to verify information, they probably don't have it. So they're asking you, could you verify your email address? They might not have had it, and you might have shared it now. If it's overly vague, so if something's like, your package has been delayed, your order, and it's not saying who, we've been trying to reach you. It's not saying who are they, what your order is, where you should go to fix it. So they don't want to tell you the source. So in this circumstance, you could go back to your dig rules and, your package is delayed. Maybe you tried to send, a gift to someone for Christmas. If you did order a package, just ignore the message and go to wherever you ordered the package and see the tracking, see the status from there. And then if you don't have an account somewhere, so if it says your Netflix account is going to shut off because your credit card is expired. If you don't have a Netflix account, it wasn't for you, you can just ignore it. If you do, again, go back to the source, just log right into Netflix and see if it's letting you still watch things, then your credit card must have been fine. Okay, so I do want to dig a little bit deeper into the digital footprint, the trail of data left behind. We did kind of touch on the social media aspect. You want to watch what you're sharing. Just because once it's out there, it's out there. And even with, security settings and things, people could share things. A good example of this is you go to a nice tropical vacation because the weather's awful today. And you post it online. That tells everybody online that your house is empty and you likely won't be back, for sure today. So you can share your photos just, after the fact. But also, another big example is some of the fun games online. It's like, here's a list of 30 questions. This is fun to reminisce and talk about who was your third grade teacher? What was your first car? These are all security questions. So you want to watch what you're sharing. Unless, of course, these aren't things you use for security questions. But again, the scammers are doing their homework. They want to collect the information and see what they can get. You can minimize this digital footprint using privacy settings in different accounts, avoiding oversharing that personal information, and being cautious when clicking on unknown links and ads. So you do want to watch what you're putting out there because, again, the prevention of it as a whole is key. Okay, so now that I've been talking at you for a while, if you guys could participate a little bit for me. What do we see based on, the red flags, those dig rules? What do we see that's wrong with this text message? Any red flags for anybody? Yes, so this link down here is not great. Just some letters and numbers. That doesn't tell me where it's going. Anything else? Yes, urgent. It wants you to hurry as an urgent reminder. Any others? Yes. Yes. Your recent claim. So what is my claim and who are you? Yes. So we hit all of them. It's got that urgent wording, immediate, urgent, your claim status, and we've tried reaching you. Who tried reaching you and what claim? Yes. Okay. And so we did talk a little bit earlier about, being safe online with starting shopping. We recommend if you're going to, dive into online shopping, especially, 'tis the season, we recommend that you start with places that have a brick and mortar, a physical location for a few reasons. First, then it's not a smaller business that could be illegitimate. It's Kohl's, Target, of course, exception to that is Amazon. But the other reason is it's not the easiest. If you get something and you ordered the wrong size or there's something spilled on it when you open it, you want to return, it is not the easiest to make the return depending on where you bought it. So as you're new to shopping online, you can always take it to the physical store to return it that way. The other things you want to look for, sometimes there's a lock, like a padlock up at the top, just to say that it's a little bit more secure. It's also going to start with HTTPS at the beginning. The S means that it's a more secure place. You want that, especially if you're typing in any financial information. So not having the S doesn't necessarily mean the site you're on is unsafe. Lots of websites start with HTTP. But that S is just an added layer of protection as far as when you put in your financial information to purchase something, it has a little bit more protection than a site without that S does. So it's a lot harder for folks to, just grab your information off of that. You always want to look for that S for typing in financial information. And then the other notable thing here is websites that end with .gov are always government sites. While I can go on, if I knew how, and make a website that ends with .com, .net, anything like that, I can't go on and make something that ends with .gov. So if you are, doing something online and it's .gov, that is a government site. It is a safer site. And I have noticed a lot of the sites now, the government sites, it says it right at the top. It says this is a, certified government site, and it says, how do I know? And it'll break that down for you as well. Ends in .gov. The other thing you really want to check is when you get to a website or when you type in a website, up at that search bar, you want to make sure that you spelled everything correctly. They do know if they, type in Amazon and instead of an M, it's a RN and it really looks right. They do know if you just glance, it looks like Amazon. And the site itself could look like Amazon. So you definitely want to check that spelling while you're checking that HTTPS. But we do have another example. So do we see anything wrong with this website? Yes, so it says Facebook.com. So you could have gotten an email that said, there's an issue with your Facebook, somebody has hacked it, log in here to fix it. And when you get here, it looks like Facebook. So you could have clicked it and it looks just like the Facebook login, and you log in, but now they have your information. So you definitely want to pay attention. And it also, you want to look for that HTTPS. Okay, so we also wanted to just highlight identifying advertisements. When you're on social media, the advertisements just mean that somebody paid for you to see it. So that doesn't mean that Target or, Miss T's Pierogies didn't pay just to have an advertisement, because we all know advertisements work. It just means that it's more likely to take you somewhere that's not a legitimate site. So we just want you to be aware that if it says sponsored, if it says ad, it just means that somebody paid for you to see it, but it's not always the safest way to do it. So if you wanted, say, a recipe that you were looking at, you could just go to Google and type in recipe for pierogies, or if you're looking to buy those, again, not clicking the link, just going and looking for it yourself. Okay, so I don't want to scare anybody, but we wanted to cover just social listening as a whole. You may have noticed, if you go and search for a red dress for Christmas, then you go to your social media, and now all of your advertisements are red dresses. Maybe you talked about it. You went to lunch with someone and you said, I really need to, get a car seat cover for this car. The seat is getting stained. And now all of your advertisements are this. Essentially, there are permissions within our phone, within apps especially, that allow them to use the microphone, use the camera, access files. The goal behind it essentially is to sell you things. So it's not always this big dark conspiracy of trying to collect all your information and everything you say. The typical use of this is to try to sell you things, try to get something in front of you that you will click on, interact with, purchase from. But you do have some power here when it comes to your phones, tablets, things like that. You can go into your settings, which we highly recommend on all devices, all websites, anything you're using. Always just kind of browse the settings. Maybe don't click too many things. You might shut something down or change the language, but definitely just to read what you have control over. So with apps specifically, a lot of times you can just turn off all of these permissions. If you need it for something like my weather app, I do allow it to have my location. That way, if I'm 30 plus miles from home, I want the weather where I am, not necessarily from my house. So certain things you do want it. If it's a calling app, you definitely want it to have access to your phone in order to make phone calls. If it's something like Facebook, it doesn't need access to your location. It doesn't need your call logs. It doesn't need your files. It would need access to your camera and your photos if you wanted to take a photo or post a photo. But again, you can hop right back into your settings and turn that back off when you're finished. So we do encourage you to look into your settings and, take control of that if that's something that, you really don't want happening. The other thing is using public Wi-Fi networks. So essentially, really nothing is free. If you go to a restaurant and you're using their public Wi-Fi, again, their goal is to collect information to sell things to you or to advertise to you. So while you're connected to their free internet, they are also collecting information. So you don't want to access things like your Medicare information, your My Chart, anything like that when you're on a public network. It is a shared space. Lots of people are using it. People who know way more than technology than I do can then see what you're doing and collect information. So you don't want to be accessing your bank and things like that while you're on public networks. The other thing with that is it's great for, you know, downloading certain things. If you needed a map and you're about to be in the mountains and you might lose service, you can download that while you're on that, and you can turn it back off so it doesn't automatically connect next time you go to that restaurant and things. So there are benefits to it. It's just be cautious with what you're doing while you're on it. Don't share your personal information while you're on public Wi-Fi. Okay, so we do have some resources here for reporting. The reason for reporting is essentially to prevent it from happening to someone else. They're always coming out with new scams. We're always talking about, you know, you wouldn't believe this happened, or, oh, this is so new, or this one almost got me. You want to share these with people that you know, especially. But you could have been, you know, one of the first people experiencing a scam, and they need to know that it's happening, again, for prevention. You cannot always recover things that have happened. But again, just that community of we need to stop it from happening to other people. So you do want to report especially to those that you know. There is the Department of Justice Elder Fraud Hotline with the FBI is a great resource. And then the Ohio Attorney General, the Ohio Protects website in general, ohioprotects.org, is a great resource for learning more about what's happening. They have videos on robocalls and prevention and things like that. Great information. And then if you are a victim of identity theft, identitytheft.gov, you would put in some information and they would give you a roadmap of what you should do next, which is really great. Just all sorts of resources and what you should do, who you should talk to. And then, of course, if you feel an insurance agent is using high pressure, fraudulent, or dishonest sales practices, please report that. While it may not have worked on you, it may work on somebody else. So if you feel that someone's pressuring you into things, lying about things, trying to, you know, get extra sales, definitely report that. And that number's on here, as well as the Senior Medicare Patrol is on here as well. That was a lot of information in a short period of time, and I know we're all hungry, but do we have questions? Yes. So he said, is there a website you can use to check on a phone number? It's possible that there is. Personally, if I get a call and I see it, I don't answer. But if it looks like something that I should know, or maybe I was expecting a call and I don't know if it's that person, a lot of times I just put that number into Google. So I don't click anything from there. It's going to pop up all sorts of things. I don't click any of the sites. But if other people have reported that number, like this was a scam, or this tried to sell me something and things like that, that's what's going to show. So if it's really not showing anything like that, it may be, you know, a personal number, but I don't use a specific site. So good question. Other questions? Yes.
I get called all the time from numbers I don't recognize and get curious, and there are lots of websites that will take you back to the owner of the phone number. However, they all charge a fee.
Yes.
At least $1 for a one-time charge, and then they'll set it up $25 a month. You can use their service forever.
Okay. So for anybody who couldn't hear, he said there are websites online where you can search a number and get it back to who the source is, like whose phone number is this, but they all charge a fee. So if it's asking for all of these things and it says, oh, free number, and it just keeps taking you through steps, it's likely not legitimate. But there are websites, he's saying, that could do that, and it's usually a subscription, a monthly cost. Yes.
And I have been telling everyone and then informing my doctors. I had an MRI done. So this can happen, okay? 3 days after the MRI was done, I received a phone call, which I'm very vigilant, okay? It didn't come up suspected spam, none of that. I answered it. The first thing the person said was, I'm calling about your reports on your radiology, your MRI on your knees and your back. And I said, and who that are you? And they couldn't, okay, give me an answer. And so I said, well, that's funny because I'm 16 years old. I hung up the phone, and this has happened twice now, and it's all through my chart. Something's going on. I hung up, called that number back, and it went to that. The person you're trying to call, the number is no longer in. So it was a spam call. So that where you talk about the urgency, okay? So yes, I was waiting on the results. They were very important. I knew better then because it didn't come up my doctor's office.
Okay, so I just want to quick summarize. She said that she had an MRI done and she got a call a few days later that said, I'm calling about your report on your radiology. And she said, and who are you? Paraphrasing. And they couldn't answer. So when she hung up, she tried to call them back. And it said the number you're trying to reach is not in service. So essentially back to don't answer if it's not a number you don't know. And she did say it didn't come up as her doctor's number. Even if it's your doctor, they're going to leave you a message. If you have your voicemail box set up and there's room, so I highly recommend learning that. Because it is, if it's a legitimate call, they're going to leave you a message. And that also gives you that time to kind of verify the source. So if you're not sure of something or you're like, is this real? It gives you time to either look it up or ask somebody else. So that's a really good point.
Because with my phone, I have two phones, but they always come up suspected spam. Okay, so I just hit decline and then go in and block it.
Yes.
Particular number happened twice.
Yes.
Hasn't been in the system long enough, I guess.
Right.
People
And
reporting it, but I did let the clinic Akron General know because
good.
how you gonna know?
Yes.
Oh, somebody gonna know I just had that MRI.
Right. Yeah. And I mean, I personally don't know how they would know. I will say, they do their homework. They're smart. They want to seem legitimate so that you'll share things. But she was mentioning that her phone didn't flag it as incoming spam or, suspected spam. That type of technology goes phone to phone. So it could be different on your phone. It's not necessarily a spam call just because it says potential spam. It could be based on your phone settings. It could be that you haven't received a call from them before. So it is phone to phone. But again, if you don't know the number, just don't answer it. Set up your voicemail box, leave space in your voicemail box, and they'll leave you a message. Yes. Yes. I will check into having this on the website with the Medicare information. Absolutely. Any other questions? Yes. Mhm. It depends on your phone. If you have an iPhone, it usually works off of Safari. Same thing, just type it into the search bar. It'll just search the internet for you. Again, I don't click on anything that pops up. I just kind of read the little snippets it gives you to see, because if tons of people have reported it, again, with the importance of reporting, so we know, it's going to come up, this person called me and tried to sell me this, or this person called, this was a spam, a spam call. But it's phone to phone. So it's just based off of what type of phone you have. But you can't add, if it's a smartphone, you can't add Google Chrome as an app. I think I've lost a few. We do have great technology information on Direction Home's website. If you, browse through our site, you'll see technology use. And we do have some awesome videos and presentations and things of diving further into devices, if you're interested in that. Okay, yes.
Yes, checks that come in once a month and they rotate around.
Yes.
Second,
Yes. So she mentioned that the library has texts that come in once a month to help with devices. Libraries are great for resources in general, but especially with technology help. And again, it's the library, so it's free assistance. But definitely check out your local library's website for what they offer, because you just never know until you check it out and see it in there. Or call. Yes. As obnoxious as the phone calls are, answering them makes it worse. They put you on that, suckers list, and they are like, this person, this is a phone call or a phone number to a person, keep trying. They will hopefully eventually find a way to fix these things or, die off because you're not answering. But answering does make it worse. Yes. Okay. I think we're going to call it. Lunches are out here. Again, the restroom is right by that registration table, right across from it. And you can go through and get your lunches. We do appreciate your time today. Thank you for listening.